Good morning to all. Today I am discuss pharmacology and toxicology subject name. Topic sedative and hypnotics. What do you mean sedative? These drugs are which produce resembling natural sleep. These drugs are produce resembling natural sleep. What do you mean sedatives? These drugs are which reduce excitement without producing sleep. These drugs are which reduce without producing sleep. Sleep is naturally occurring phenomena. Sleep is naturally occurring phenomena. These drugs, hypnotics and sedatives, both cause depression to the central nervous system. These drugs, sedatives, depression to the central nervous system. Their differences is being in depth of depression produced to CNS. The sedative may be considered to mild hypnotics and hypnotics as mild sedatives. The qualitatively hypnotics and sedative produce depressions of central nervous system. The difference between them is quantitatively. Next, classification. The sedatives and hypnotics are classified into two classes: barbiturates, non-barbiturates. Barbiturates subdivided urea derivatives, for example barbiturates. Next, long-acting barbiturate, for example drugs phenobarbital and mifepristone. Short-acting barbiturates, for example butobarbital, secobarbital and pentobarbital. Ultra short acting, with example thiopentone and kexobarbital. Next, benzodiazepine. Benzodiazepine subdivided hypnotics, for example diazepam, clonazepam, flurazepam and nitrazepam. Next, anti-anxiety drugs, for example diazepam, chlorodiazepam, lorazepam. Anticonvulsant drugs, for example oxazepam, diazepam, clonazepam. Non-benzodiazepine, for example zolpidem, zopiclone. Miscellaneous, for example chloral hydrates, triclophos, paraldehyde. Next, barbiturates. What do you mean barbiturates? These are organic hypnotics, the barbiturates and derivatives of barbituric acid, which has been prepared by urea and malonic acid. What do you mean barbiturates? These are organic hypnotic and barbiturates are derivatives of barbituric acid, which has been prepared by the condensation of urea and malonic acid. Barbituric acid itself does not possess hypnotic activity, but hypnotic activity is produced if the hydrogen atoms at position 5 are replaced by alkyl or aryl group. Replaced by alkyl or allyl group. Next, pharmacological action. Pharmacological action of barbiturates. Analgesic effect. Barbiturates do not act as analgesics. They do not relieve pain. Barbiturate do not act as analgesic, do not relieve pain. It is smaller doses they increase pain. Barbiturate enhance analgesic action of para-aminophenol derivatives and salicylate. Next, anesthetic effect. These ultra-short acting barbiturates, when administered intravenous, produce anesthetic effect. Example thiopentone and methotrexate. It is useful for the purpose of general anesthesia. Next, action of central nervous system. Barbiturate produce CNS depression, mild sedation, hypnosis and anaesthesis. Where are you produce the barbituric acids? Barbiturate produce CNS depression, mild sedation, hypnosis and anesthesia. The hypnotic doses of barbiturates produce sleep, which is said to be natural sleep. Next, action of respiratory system. Sedatives and hypnotic dose do not affect respiration. The larger doses depresses respiratory system by depressing respiratory center in medulla oblongata. Is depressing respiratory center in medulla oblongata. Next, action of liver. Normal doses of barbiturates do not affect liver. Anesthetic dose might produce hypnotic dysfunction. Action on liver normal doses of barbiturates do not affect liver. Anesthetic dose may produce hypnotic dysfunction. Next, action on kidneys. Normal sedatives and hypnotics does produce no effect on kidney. Normal sedatives and hypnotics dose produce the no effect on kidney. Next, action of cardiovascular system. Cardiovascular system used in produce the blood pressure and decrease the heart rate. Then higher and toxic doses of produce. Next, action of uterus. Force and frequency for uterine contraction are depressed at toxic dose. Next, therapeutic of uses of barbiturates. First one, hypnotics to relieve insomnia. Hypnotics to relieve insomnia. Causes sedation in case of anxiety. Causes sedation in case of anxiety. Next, used of pre-anesthetic drugs to produce basal anesthesia and general anesthesia. Used for pre-anesthetic drug to produce basal anesthesia and general anesthesia. Barbiturates ask anticonvulsant effect in the treatment of tetanus and status epilepticus. Barbiturate has anticonvulsant effect in treatment of tetanus and status epilepticus.